Okay. I hear you. Everyone's screaming, Roach, just open the bag. Okay, so we've done the outside pouches. What I like is a kind of double zip, and I always sort of centre the zip so you pull them both open at the same time. That's how the bag opens. Okay, so this is a basic life support bag. Bring it a bit closer, show you what we... Okay, let's start at the top. Here, this pouch is just incidentals really. Emergency dental kit, some plaster. I like plaster, I don't like plasters. So I like big strips. This is 2 inches wide, it's about 2 foot long. And I like 2 different types. So if I want a plaster, I just cut a plaster off. On the other side, half a dozen little plasters. But this is my plaster of preference. Given a choice, I'll just have a big roll of this in my bag. I've got tourniquets, I've got glow sticks, I've got earbuds, I've got antiseptic hand gel for cleaning my hands, I've got pins, all those sort of incidental kind of rubbishy type items that are extensively minor injuries live in this pouch. Some spare stuff, you know. Next one down, I like big bandages. I don't really go overboard on little things, you know. So what I've got here is a big couple of big crepe bandages. If I need a small bandage, I just get my shears out and I just cut it down. Much better that I have something too big than too small. Chemical ice packs, so 2 chemicals, crystals inside. You literally just kind of pop the crystals inside the bag, chemicals mix and it becomes very cold. So we're trying to reduce swelling, inflammation. You know, it's a step up from the magic sponge for footballers and all the rest of it. So cold packs. Next to those, space blankets. This pouch here is just full of triangular bandages, and I like the kind of cotton triangular bandages. You can do almost anything with them. You can use them as a pad instead of a big handful of gauze. You can use them as a bandage. You can use them as splinting equipment. The possibles with a triangular bandage are almost endless. Next one is ambulance dressing. So again, 3 sizes of ambulance dressing, and there's a 1, 2 and 3. A 3 would be a kind of 6x4, 6x6 pad, and they get slightly smaller. I've got antiseptic wipes, and all I would do is pull out a wipe the wound, put a dressing on it, cover it up. Again, mostly they're kind of big dressings, they're sterile, they're in their packets still. So this is all basic life support. Got one stiff neck collar in my kit. Adjustable, and it's short, medium, or short, regular, and what's called a no neck, but it's a stiff neck collar. So think road traffic accidents, fall from height, that sort of thing. I've got a soft collar here. Soft collars really, you know, you'll find medical professionals that will tell you soft collars are absolutely pointless, and to a degree they are right. What you can do with a soft collar is you can upgrade it, you know. So what I've done in the past, I've put someone in a soft collar because that's all I had, and then what I did was took a medium-sized towel, soaked it in water, wrung it out as best I could so it was as dry as possible, folded it up into a long strip, and then I put that over the top of the soft collar. That gave the patient a lot more cervical spinal support. The other thing I did is I took a blanket, folded it into a long strip, rolled it up from both ends and made a makeshift set of head blocks, put the patient with the towel and the soft collar between the head blocks, take their head down and waited for the cavalry to arrive. Soft tissue damage, sometimes a soft neck collar is of use. This side of the pack really, so eye wash kit. You know, remember, if someone's got something impaled in their eye, an eye injury of some sort, the eyes move together. So just try to remember to dress both eyes. If you just dress the injured eye, the good eye is kind of looking around everywhere and the bad eye is moving with the piece of whatever it is stuck in it. which just makes the injury worse. So eye injuries, kind of damp dressing. If you've got some saline, that's all good. Warm water, again, wring it out so it's just damp, and dress both eyes. That's my little kind of eye injury kit. Here I've got a BP cuff, stethoscope, and a pulse oximeter. Pulse oximeters nowadays are, you know, when I was a kid it would be kind of Star Trek, you know, where the doctor would wave a little box over someone and it would tell them what's wrong. So again, basic stethoscope, so chest sounds, blood pressures, apexes and bases of the chest, just to evaluate someone's breathing. You know, a normal respiration rate is between 16 and 24 breaths a minute. You will find people that disagree with that, but that's my kind of rule of thumb. This is a sort of an electric pulse oximeter. You literally just turn it on, put it on the patient's finger, and it gives you a constant oxygen content in the blood, and it should give you a constant pulse. So my pulse, oxygen content 97%, that's okay. Pulse 77, that's a bit high. 60 to 72 is somewhere near resting normal pulse. Great gadget, just put it on, forget about it. They cost next to nothing, so I think we're talking about 10 or 20 pounds for a kind of pulse oximeter nowadays. BP cuff for taking blood pressure. So the two differences in blood pressure are systolic, diastolic. So the highest one is the heart pumping the blood out, and the lowest reading is the heart at rest. For a healthcare professional, both of those things are pretty important, but more important is the gap between those two numbers. You can ascertain an awful lot by a accurate blood pressure, and no healthcare professional is going to tell you that they are going to accept one blood pressure. You know, if you can get two 10 or 15 minutes apart, that's brilliant, gives you a good idea of whether the patient's getting better or worse. Stethoscope for taking the blood pressure, but also to listen to chest sounds. If people have got chest injuries, you know, what we're going to do with a chest injury is we're going to seal the box. So imagine the thorax, the chest, from the Adam's apple, from the kind of throat down to the navel. That's the box. And what we're going to do with the box, or what we want to do with the box, is we want to seal the box. If there are any holes in it anywhere, the simplest possible, seal the box. That's one of the greatest bits of advice you'll ever get. If there's anything stuck in it, you got to leave it in it. You know, there's no point packing a wound in the chest, because all that's going to happen is you're just going to push things into the heart, the lungs, the abdomen, and that's all going to be bad. So what we want to do is seal it. In my IFAC kit, I've got black tape. In here I've got chest seals and thorax seals, but that's what we're going to do with the chest. Once we've sealed it up, our stethoscope is going to tell us whether there are still good breath sounds, good equal breath sounds at the apexes, which is up by the head, and at the bases, which is down by the navel. Airway, I've just got a bag valve mask here. I've got some other kind of bits and pieces in here, so I've got a full set of Goodell Airways. I've got some KY jelly. This is a great gadget. Very simply, it is a safety valve. So when you're breathing for somebody, when you're inflating and deflating the lungs, this little gadget tells you whether the air is going into the lungs or it's going into the stomach. Peak flow meter, so anyone with asthma, COPD, they would have had peak flow done fairly regularly, and it just measures the capacity of the lungs. So these are all diagnostic bits and pieces. Got a big bag valve mask, positive pressure ventilations with a piece of tube on there. Sometimes you'll find patients have their own oxygen. That's why that's on there. And this is a Handheld Suction. It's a very basic disposable suction unit, so if someone's got an occluded airway for whatever reason, various bits of kit, so there's catheters that can go in here and you literally just suck out whatever it is in the airway. So I'm thinking soft tissue damage, maybe someone's been in a fight, they've lost a couple of teeth, they're bleeding in their mouth, it's going down their airway, or they've lost dentures. The possibles are almost endless, but you know, vomit, blood, those sort of things can occlude an airway, dentures, you know. So that's my kind of airway management bag, and I've got a 100% rebreathing reservoir, so if there is oxygen, this fills up with 100% oxygen, gets plugged into the bag. That's what we're giving the patient, and in the short term, or if a patient's being resuscitated, 100% oxygen is a good thing. It's as good as it gets. That's my airway bag. Up here I've just got burns gel dressings. So these are all water gel, burns gel dressings. What I've got in here is I've got a big face mask. Well, I wouldn't necessarily just use it for a face, you know, that is a big dressing. If I've got a big burnt area, I'd gladly use that dressing on it. They come with a sort of jelly, sort of yogurt-y type effect. Their function really is to draw heat out of the wound, but with burns, really simple, cool and cover. I think that's probably all we're going to be able to do with burns. Okay, you can never have enough gloves. I've just got a box of gloves. Sometimes you can be on scene and you can give gloves out to other people, but for whatever reason, you know, I like to put 2 or 3 pairs of gloves on before I commit to scene, and that way when I go from patient to patient, I just take a pair of gloves off, you know. Couple of little torches. These ones come from Polymath products, but again, you know, if you've got bystanders, friends, relatives, and it's dark, it's raining, like it always is, then just give them a torch. Hold that for me, blah, 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 blah. They feel involved, they've got something to do, and it reduces everybody's stress if they feel involved. This kit here is just my kind of hypervolemia, you know, so this is big, loads and loads and loads of sterile gauze, ambulance dressings and bandages. I've got some quick clot, so clotting agent. There are 2 or 3 different types. The other thing I keep in this bag is chest seals, a couple of those. So we've got, you know, a stabbing, impalement, whatever it is, whatever has punctured the box, it needs to be sealed. Chest seals, if you haven't got chest seals, you know, black masking tape, somehow seal the box. So this is my kind of immediate action bleeding type kit. Extensive blood loss, that's one of the first things I grab. This is a really funky little gadget. It's called a SWAT T. Very simply, it's a 4-inch wide long rubber band. This one's bright orange. I'll drop some pictures in for you as to what it is and how it's used. I like this over a run-of-the-mill tourniquet because this can be used as a pressure dressing. So if we put this on a little bit looser, it can get direct pressure over a wound, yet the limb is still being perfused, as opposed to the need for a complete tourniquet. But if you need a tourniquet, you can just put this on a bit tighter, you know. So I'll drop some pictures in about the SWAT T. You'll see what that is, and that goes in my extensive blood loss part of the kit. So again, we're still, you know, all basic life support. Going to take a big step now and talk about airway. So the best airway you can get is an ET, Endotracheal Tube. Goes all the way down through the vocal cords into the trachea. There's a balloon on it, balloon inflates, and then we have a secure airway. We can ventilate the patient with 100% oxygen, and we know that no foodstuffs or anything like that are going to come up from the stomach to compromise the airway. So when you commit to CPR, a lot of the time, if people's CPR is a little bit slack, maybe wrong hand position, what you can be doing is you can be doing you can be putting an awful lot of pressure onto the esophagus, and the air, the pressure you generate goes into the stomach, and the contents of the stomach then comes up when you're trying to ventilate the patient. Secure airway. ET tubes are advanced life support. They're sort of paramedics, anaesthetists, nurse practitioners. These things are called eye gels, and they are absolutely brilliant. If you were to go in for day surgery, so you would have a general anaesthetic, have some sort of minor surgery and come out the same day, you would probably be put to sleep and monitored with this type of airway. So what happens is we have a tube, got some KY jelly, so we lubricate it, we get the patient on their back, sniffing the morning air, jaw slightly raised. This will slide in, and you're going to put it in from the very top of the head, and on that goes our CO2 monitor, clips on here. And then what happens is we have a disposable piece of kit that goes onto the end of the tube, and that goes onto the bag valve mask. All of this is disposable, so there's no risk of cross-infection. These tubes are a big step forward. This will give you a very secure airway. It's not 100%, but we're not doctors, paramedics or anaesthetists. These are the three major sizes, but you can go down to pediatrics, children and babies. There's an extensive set of them. I've just gone for the small, medium and large for adults. Still talking about basic life support, people. So suddenly we've done airway, breathing, circulation, arrest major hemorrhage, all out of this bag. I always have a big bag of assorted tapes. I like plaster. Given a choice, I'd just have a big bag of plaster. This 2-inch fabric tape is great for holding, IVs, cannulas, that sort of stuff in place. If someone on scene gets IV access, it can't come out. If it comes out and the patient is traumatized, first thing that happens is the blood supply to the periphery is switched off and shut down. All those blood vessels constrict, and then it gets to a stage where you're trying to put a needle into a piece of cotton. It's almost impossible. If you do get IV access, it's imperative we don't lose it in the field. So once I used to get IV access, I pull off a couple of bits of tape and I put a 4-inch square piece of tape with a hole cut in it so I can get to the drug port, and that just ensured that IV didn't come out. So in this bag I've got paper tape, micropore, 2-inch plaster. I've got normal kind of plaster tape, but whatever I need is kind of in that bag really. So if it's a bit of gauze and a bit of tape to hold it in place until the first aider, the ambulance, the whatever arrives, then that's all good. If we've got a little bit of time, we can put a dressing on it, we can make it a bit pretty, we can protect it a bit more. So tape. My last thing really is a pair of safety goggles. So if you have a instance where you've got body fluid, so urine, projectile vomiting, blood loss, if someone's had a facial injury, maybe lost a few teeth, they may project spittle when they talk, and it's very easy to get that sort of stuff in your eyes. If you get a body fluid into your eye, it's almost absorbed by the body straight away, because the blood vessels within your eyes and your eyelids are very close to the surface, and they're very, very rich in oxygenated blood. So whatever that cross infection is pretty much in your bloodstream instantly. So any risk of cross contamination, I've kind of put my glasses on, and The only thing I really want to take home to my beautiful little family is me. I don't want to take home hepatitis B, hepatitis C, HIV, any other infectious disease. So any risk of that, and I'll put my safety goggles on. So it's quite an extensive basic life support bag, but there's a couple of things that I kind of like to add to it, and I'll show you those in a second. And these are things that people just don't have in a basic life support bag type setting, and they will be worth their weight in gold.